disaster preparedness. We're going to give people a couple of more minutes to sign in and join, just as it has become 11 o'clock. So thank you for being on time. We won't delay the start for too long, and it will be a fantastic discussion with some leading experts in preparedness that I think all of you will enjoy. So thank you so much for dialing in, and we will start soon. Well, as I see it is now 11:02, I think it'd be a good time to get started. Once again, my name's Brandon Stevenson. I'm with the California Partnership for Access to Treatment, and thank all of you for taking some time out of your day to join us for our webinar on disaster preparedness, resilience, readiness, and resources for patients and caregivers. As you see, there's a couple of hashtags on the main slide there. If you feel like being part of an online conversation, please feel free to tweet or post on Facebook and use those hashtags. Also, if you have questions that you'd like the presenters to answer towards the end of the webinar, please feel free to type in your questions in the chat box, which should be on the right side of your screen, and I'll keep track of those and be sure to ask them later on in the presentation. Real quick, I'm going to give a very brief overview of what CPAT is before we get to our presentation. So the California Partnership for Access to Treatment, it is a diverse network of business groups, health groups, patient advocacy organizations that have come together, and we provide these organizations with information and resources about California's changing healthcare system so that they can provide better services on behalf of their constituents. We do these type of seminars both in person throughout the state as well as webinars to not only provide information, connect you guys with expert speakers, but when we do in-person events, allow you guys to network with each other and build partnerships, because as we all know, if we want to improve health outcomes in California's communities, we have to do that in a collaborative fashion. We have more than 1,500 statewide partners, everything from hospitals to doctor organizations to patient advocacy groups to community-based organizations to churches, you name it, we have them. And we're pleased to have anyone else join. It's a free network, and there'll be some email addresses at the end of the presentation. You're free to contact myself or my colleagues if you'd like some information about joining the California Partnership for Access to Treatment. We're very active on social media. Once again, here are some hashtags. Please feel free to join the conversation on Twitter. Please make sure you tag CA Access so that we can be part of it, and really appreciate your participation. We're very fortunate to have a recorded welcome from Assembly Member Monique Limon. She represents the Santa Barbara and Ventura areas who were hit earlier this year and last year with some devastating fires. She couldn't participate live on the webinar, but she wanted to send a
Hello, I'm Assembly Member Monique Limon, representing the 37th Assembly District, which includes portions of Santa Barbara and Ventura counties. As we have seen from recent earthquakes, fires, and floods in California, all of our communities and families, especially those with medical needs, must have a disaster plan and understand what resources are available to them in an emergency. Those in my district have suffered from disasters including fires and debris flows. I know how important it is to have a plan in place to keep you and your family safe. Today's webinar will provide you with the tools necessary to create your own preparedness plan in case of an emergency. Those who are taking care of aging family members or have chronic diseases of their own will learn how to take precautions that are critical to their health and safety, as well as what organizations are available to help locally. Thank you to Healthcare Ready and the California Partnership for Access to Treatment for putting together this timely conversation to support preparedness and resiliency for all Californians.
I'd like to now hand it over to Sarah Baker with Healthcare Ready, who's going to lead our presentation and introduce some of our other panelists. So with that, Sarah, please take it away.
Sure. Thank you so much, Brandon. So good morning, everyone. My name is Sarah Baker. I serve as the Programs Director for Healthcare Ready. And for those of you who are maybe new to our organization or haven't heard of it before, I'll be giving an overview of who we are shortly. But I also wanted to note that I'm very pleased and grateful to be joined by two esteemed partners in the state of California. First, we have Mr. Vance Taylor. Vance is the Chief of the Office of Access and Functional Needs at California's Office of Emergency Services. In this role, he's responsible for ensuring the needs of individuals with disabilities and persons with access or functional needs are identified before, during, and after disasters and integrated into state emergency response plans and emergency management systems. So thank you very much to Vance for joining. We're also joined by Dr. Dana Grau. Dana is with the California Department of Public Health Emergency Preparedness Office, where he leads the Emergency Pharmaceutical Services Unit. So Healthcare Ready, we've worked very closely with both these departments in the past, and I want to thank them both for joining today. So kind of moving on, wanted to give kind of an agenda of what we'll be covering today. So like I said, I'll be giving an overview of Healthcare Ready. We're a national nonprofit that focus on disaster preparedness and response and have a number of resources and services available for patients and caregivers and public sector responders all over the country. So I'm happy to give an overview of who we are and what we do. But then I'll be turning the floor over to Vance for a few minutes as well to give an overview of, first I'll be turning it over to Dana to be giving an overview of the Department of Public Health, some of their resources and initiatives in the health preparedness space, and then turning it over to Vance for a few minutes as well to kind of give an overview of Cal OES's resources and initiatives and some of the priorities and how these groups are working together.
And Sarah, this is Brandon. If possible, some of the attendees are asking if you can speak a little bit louder.
Oh, absolutely. So after we each kind of give an overview of our organizations and our resources, just going to spend some time really digging into the value of health preparedness and why this matters today. I think by nature of the fact that you're on the webinar today, there'll be a lot of preaching to the choir in that regard, but as we're seeing, disasters are kind of the new normal, and it's not just catastrophic events that can impact healthcare and public health and the well-being of patients, but some of those smaller disasters as well, power outages, heat waves, cold days, things like that. We'll also be talking, and so from there, we'll segue into some lessons learned from recent real-world events, including the wildfires in California, both last year and in 2017. And closing with some resources for both patients and caregivers. So we want you to be able to walk away with some resources to download or things to kind of keep in your back pocket and saved on your computer or printed out for the next emergency, things that you can share with your loved ones and with your networks as well. So Healthcare Ready, like I said, we are a national nonprofit, so we are based in Washington, D.C., but like I said, a national nonprofit. So we do operate at the national level and will support the response to any event impacting healthcare public health across the country. And we have kind of a pretty unique and what I think is an interesting origin story. As you can see on the slide here, one of the challenges among the many after Hurricane Katrina was determining how private sector healthcare could work with public sector emergency managers and public health departments to make sure that medicines and medical supplies were getting where they needed to be. So there was a need for a central place for these partners to come together, solve problems, figure out where areas of greatest need were, and how to get donations of medicines and medical products to the areas of greatest need. And so our organization was founded originally under the name of RX Response. And so RX Response was founded to help serve as the central coordinator to all hazards. So not just natural disasters, but disease outbreaks, any kind of man-made event. So we were really there, we were founded to help coordinate the response to any kind of event impacting public health or healthcare. So we've been in existence now for just over 12 years, and we changed our name from RX Response, as we were originally known, to Healthcare Ready a few years ago, because we were seeing that a lot of our requests were coming not just for medicines, but for other healthcare issues, things like coordinating dialysis needs during disasters, making sure that making sure that electronic health records, that emergency responders were able to access these. So we were seeing that healthcare was increasingly complex and growing, and so we changed our name to reflect that while we still worked in that core space of making sure patients had medicines during disasters, we were helping with more than just medicines and broader healthcare needs. And so as we continue to exist today, like I said, we are a disaster response organization, so we do coordinate information sharing and route donations during events, but when we're not activated for a disaster, we're doing a lot of education and awareness events like this to help partners across the country know what some of the lessons learned are that we saw during disasters, and helping to partner, again, private sector healthcare with public sector emergency managers, public health departments, law enforcement. So we really see ourselves as kind of a bridge, and making sure that those connections and relationships are made before a disaster. And so as you can see here, a handy diagram we like to use is in the middle here that illustrates that we sit between healthcare and emergency management and between the private sector and the public sector. So again, we try and act as that bridge, so making sure that everything all the way from the beginning of the healthcare supply chain, so pharmaceutical manufacturers, all the way down to pharmacies are connected, and that there's a central coordinator among them to make sure that information is shared and resources are where they need to be. So since we're a disaster-focused organization, we like to say we have the luxury of thinking about partnerships every day. So I was very excited at the opportunity for this webinar to get in front of some new patient groups and some new partners in the state of California, where even though we're a couple thousand miles away based in Washington, D.C., we do still work closely with partners there, especially during wildfire season. So just a quick slide of the disaster response support that Healthcare Ready provides. So as I was alluding to earlier, we do a lot of information sharing. So sharing information from healthcare, so what pharmacy needs are, what some of the challenges are that healthcare facilities might be facing, with public sector responders, so elected officials, but also federal partners at HHS and FEMA, but our state partners as well. So kind of, again, acting as that central coordinator. Another big role and big activity we have during disasters is donation and coordination. So we help identify areas of greatest need, whether those are in shelters, community health centers, or any facilities that are serving patients. We help coordinate and get donations of medicines, medical products, durable medical equipment, medical gases like oxygen. We're able to use our wide network of partners to help meet needs that we learn of. One one note I also wanted to mention in terms of some of the information sharing we do is on medicine assistance programs. And so I'll get into this in a few minutes later in the webinar as well, but we know that there are both state programs, but some federal programs, but many private sector programs that offer prescription assistance and other medicine assistance. And a lot of times these are expanded or otherwise changed during states of emergency. And so we play an important role in pushing out this information and making sure that patients, patient groups, and our partners on the ground are aware of these programs. And then one of the maps we provide that hopefully some of you have maybe heard of, if not, we'll get into in a few minutes, is our RxOpen map. So there's an image of it on the right here, but RxOpen is our map that's available at no cost. You can just go to rxopen.org, and it's a map displaying the status of pharmacies in areas impacted by disasters. So whether the pharmacy is open, closed, or has an issue reported. And it has contact information for those pharmacies as well. So for patients that maybe are evacuating an area due to a wildfire or a hurricane, the map can be used to find an open pharmacy nearby. But we found that it's not just patients who use the map, but first responders, state and local partners as well. So we'll get into that in a few minutes. But this is kind of the high level, the suite of assistance that we provide to patients, caregivers, healthcare providers, and our partners at the state and local and federal levels during disasters. So again, this is just another slide here, kind of summarizing the support we provide. So for many events, we'll push out what we call sit reps, which is short for situation reports. And you can sign up to receive these sit reps on our website. And this is just an email that we send out at the end of each day during an activation of what some of the challenges are in healthcare that we're seeing, but also a comprehensive list of resources that we know are coming online or available. So things like transportation assistance or routing assistance, links to states of emergencies, things like that. We also stand up event-specific web pages. So for a few days ago, for example, we had our Healthcare Ready/Dorian web page. So we stand up a single web page where all the information related to health needs and health responses in one space. And so I won't get into the rest of these, but I just wanted to have one slide that kind of captures all of the resources that we provide during emergencies. And at the top of the page here, you can see kind of how we support healthcare facilities, so making sure that community health clinics, pharmacies, dialysis centers, sometimes hospitals, that they have what they need to continue to serve patients. After focusing on facilities, we also focus on the people, so making sure providers, patients, critical staff at facilities have what they need. And then finally, focusing on the patients themselves, so pushing out prescription assistance information, operating RxOpen, and a few other resources I'll get into. But that's kind of, at a high level, the space we fill and the roles we play during an emergency. So now I'm going to spend a few minutes talking about RxOpen, the pharmacy status map that I referred to earlier. So before talking about the map, just have some statistics here on knowing why pharmacy status is important. Number of statistics here about the percent of pharmacies or percent of Americans living within 5 miles of a pharmacy is over 90%. We know that, and the number of prescriptions that people are on is increasing every year. So we know that continued access to your prescription information or to your prescriptions, especially if you're managing not just one, but even up to 2 or 3 chronic conditions, that maintaining access to medications, physical access to medications, is incredibly important. We also know that pharmacies are an important place of care, because many times during emergencies, folks will turn to emergency rooms as an alternate, even if they don't have an emergency medical need. When it's a time of emergency or chaos, folks will often turn to an emergency room because they're not sure where else to go, when maybe all they need is to go to a pharmacy to get a prescription refill. So during emergencies, we can see that emergency departments and emergency rooms can be overwhelmed with patients who don't always have as urgent a need as others. So kind of knowing what pharmacies are open or closed can help alleviate some of that demand on emergency rooms and emergency departments. And finally, we also know that pharmacies provide many more resources than just prescription refills. Pharmacies have food, water, batteries, other kinds of community resources, any kind of other resources that community needs during disasters. So they're really oftentimes an anchor institution within communities. So knowing when they're open or closed helps with prescription refills, but so much more than that. So here is kind of a quick snapshot of Rx Open right now, and you can see this is what it looks like when the map is turned on. So you're able to see open and closed pharmacies, as well as pharmacies whose statuses may be unknown because we don't have information on them. But you're able to hover over the screen and you can get the contact information for these pharmacies. So you can search by zip code, you can search by your city. There's a search bar on the map. And I don't have a picture of it here, but there are actually two maps on the Rx Open site. The individual pharmacy status map, which is displayed here, but also a county level map. So you can see the percent of pharmacies that are open in a county. And we'll turn the map on for any event impacting healthcare or public health. So we've turned it on for wildfires, we've turned it on for hurricanes, any kind of event that it might be useful, we're able to turn it on. And the Rx Open map is a unique partnership as well in that pharmacies don't have to report their status into us. They don't need to call or email us with their status. We receive data feeds on whether a pharmacy has filled a prescription in the last 12 hours or not, and that's our proxy measure for whether they're opened or closed. So that's why the Rx Open map has pharmacy information from chain pharmacies like CVS, Walgreens, some of the big names there, as well as the individual, independently owned pharmacies, so some of your mom and pop pharmacies, ones that aren't part of a chain. And here's just a slide kind of encapsulating what I was mentioning earlier, that the Rx Open map is important for patients to be able to refill medicines, access durable medical equipment and emergency medical services, but other needs as well, like being able to find places to charge their phone or to charge their medical devices. And so we've seen that the Rx Open map is really valuable for patients for a number of reasons. But as this bottom half of the slide here gets at, it's useful for emergency responders, for the public, and other response NGOs, nonprofit organizations like the American Red Cross. Excuse me. So we actually just turned the map off earlier this week. We had it turned on for Tropical Storm Karen, and before that, Hurricane Dorian. So we've seen that, with the increasing frequency of disasters, the Rx Open map has been used more and more. And again, it's just rxopen.org, and we'll be able to, you can go there anytime to view the map when it's activated. And when the map isn't turned on for a disaster, you can see static pharmacy information of pharmacies all across the U.S. And so with that, that was hopefully a helpful overview of who Healthcare Ready is and the Rx Open map that we provide. And I'm just going to turn it over to Dana Grau to give an overview of the California Department of Public Health, their resources, and how the Department of Health engages in emergency preparedness and response.
Thank you, Sarah. Before I talk about the California Department of Public Health, I would like to give a shout out to Healthcare Ready and Rx Open. We've gotten to know each other on a first name basis, for better or for worse, over the last few years. And as a pharmacist who practiced for many years, encouraging people to take their medication as they're supposed to, it's really important to us to ensure that people who are affected by these disasters can get their medication. And we've seen with both the earthquakes and now wildfires the people are displaced without warning, and one of the challenges that we are facing is our ability to link up the patients who may be in shelters with pharmacies that are open. So once again, don't forget RX Open in your next disaster. They're an invaluable tool. In California, our disasters have both public health and medical impacts, and it's important that many organizations, both in the private and public sector, are able to successfully respond to the public health and medical consequences of disasters. The Department of Public Health is a multifaceted organization, and many of our centers and offices rapidly have to transition from day-to-day activities to response activities. For instance, we have our Center for Healthcare Quality, Licensing, and Certification, whose job is to protect patient safety by ensuring that healthcare facilities are in compliance with federal and state laws and regulations. A little later in the program, I'll talk about their ability to assist these same facilities in repopulating if they've had to evacuate or close for whatever reason. We have a Center for Infectious Disease that has a large number of subject matter experts and laboratories to be prepared to respond to infectious disease outbreaks. And we'll talk about a norovirus outbreak at one of our shelters during a recent disaster and the important role that they played in being able to mitigate the effects of that. We have a Center for Health Statistics and Informatics. These are the folks that are responsible for birth certificates and death certificates in California. And in these disasters, when homes burn rapidly in large numbers, these folks play a tremendous role in being able to recreate these documents to assist people to get back on their feet. We have a Center for Environmental Health that impacts programs dealing with drinking water, Food and Drug Branch. We even have a Nuclear Emergency Response Branch. We have a Center for Health Communities, which contains a large number of subject matter experts for environmental and occupational exposures. Once again, during the Camp Fire, we found that the ground on which people's homes once were located became contaminated because of the meltdowns during the fire. And here in the Emergency Preparedness Office, where I work, we have a number of programs that transition rapidly into the response mode. We have a Duty Officer program, which is a 24/7 point of contact for referral to various programs that can be of assistance during disasters. We house the California Health Alert Network, or CAHAN, which is a 24/7 means of distribution of health alerts, guidelines, and coordination to a large number of partners, including healthcare facilities. Here in the Emergency Pharmaceutical Services Unit, where I work, we have the ability to respond to federal assistance. We are able to, for instance, during a recent disaster, we were able to move a large number of cots to shelters to assist them. And then finally, we have a Medical and Health Coordination Center, which is an EOC that's shared by CDPH, the Emergency Medical Services Authority, and the Department of Healthcare Services. It's a coordination center for Emergency Support Function 8 during an emergencies. For instance, it's currently activated for the vaping-associated illnesses, so it touches a lot of different aspects of public health and medical emergencies. A couple resources that I want to talk about are the California Public Health and Medical Emergency Operations Manual. The goal of the manual is to strengthen coordination between the public health and the medical system during unusual events and emergencies. Its purpose is to build a common operational framework It strengthens the ability of the system to rapidly and effectively respond to emergencies. Once again, it's entitled the California Public Health and Medical Emergency Operations Manual, or EOM. I'll talk about that a little bit more, but that's something that you might want to become familiar with. Final resource that has just been published, or has at least been shared with stakeholders, is our Wildfire Smoke Guide. It hasn't been posted on the net yet, but watch for it in the near future. It discusses and provides some guidelines for what we learned with the smoke that was generated during these wildfires. For instance, as I hope many of you already know, that N95s are only appropriate for some individuals, but not all individuals. And as a matter of fact, the N95s can have a deleterious effect on some populations. So be on the lookout for that document in the near future, because the best advice for smoke is to stay indoors, but more to be published very soon. So Sarah, with that, I'll turn it back to you.
Great. Thank you so much, Dana. I know as soon as that resource is published on the web, I will make sure to send a note around to folks, or if it's available soon, maybe even in the wrap-up to the thank you note that comes out with this webinar recording.
Great.
All right, and now I'm very pleased to turn it over to Mr. Vance Taylor with the California Office of Emergency Services to give a few resources and initiatives that Cal OES has underway. Are you there, Vance?
Yeah, sure am. Can you hear me okay?
I can, thank you.
Hey, fantastic. So by way of background, let me talk just a little bit about, and thank you, Healthcare Ready for the opportunity to present. I think anytime you can get a good group of stakeholders together like this, it's invaluable. Let me, start by just giving a little bit of background on the Office of Access and Functional Needs. So the office was originally created in 2008. The governor placed it within his Office of Emergency Services. He made it an executive level leadership position, designed to be an appointee that led the office in essentially a twofold mission. Mission number one, so the first part of that mission, is to identify what are the needs that individuals with access and functional considerations have before, during, and after disaster. And then number two is to kind of wrap your arms around that and then integrate those needs throughout the emergency management process. And the background and context for this really stems in the fact that historically, individuals who are older or have disabilities or transportation disadvantaged, who don't speak English as their primary language, individuals who are children or women in late stages of pregnancy, all these different populations are disproportionately impacted during disasters. And so Hurricane Katrina, for example, puts a good light on that, a strong light on that. We saw in Hurricane Katrina that out of everyone who died, 70% of those individuals had access or functional needs. And that's because in the traditional emergency management process, where we plan, respond, and recover, did not address those particular populations. And it's not that anybody was trying to leave somebody out. It's really more just a question of perspective, that we tend to plan and approach things from our lived perspective. And in emergency management, you have a lot of former military or law enforcement or other individuals, most of whom do not have a lived access or functional needs related experience. And so you would literally have these plans that said, when we evacuate, we're going to send a bus, right? Multiple school buses. We've all seen those images. The school buses pull up and people get onto them and they whisk them off to safety. Well, somebody in a wheelchair would come up and ask, where's the bus with the ramp or the lift? And I was like, oh, we didn't think of that. And so we have to think about what does that do, right? Not only are you putting people in harm's way, because then they can't get out, but what message does that send to that individual about the value of their life, or the degree to which the community they live in could consider their needs or cares about them. And so for a very long time, people with access and functional needs have felt marginalized in the emergency management process. And now we've come a long way. Perspective has been broadened. And as we've gone through more and more and more disasters and run up against more and more challenges, we've become more proactive and innovative in the way that we meet these needs. And so we find that there has now been what we would call a cultural shift within emergency management, which is to say that there's a very clear recognition that if what we do as emergency managers does not benefit the whole community, then there are critical gaps that have to be addressed. We no longer just send school buses. We send vehicles at accessible paratransit. We have accessible evacuation routes. We go to shelters that are set up to not just be physically accessible in terms of people being able to get in, but that are programmatically accessible in terms of being able to provide wraparound services to ensure that everybody's welcome and that everybody can have their safety, their security, and their dignity throughout what tends to be the worst experience of their lives, because they've either lost everything or loved ones or been put in harm's way through a variety of disasters. And so we really value that work. Now, what we've found is, as emergency managers, there's a lot that we can do, but there's not this magic silver bullet that tells us we can do it all. And so ultimately it comes to partnership. And when we look at those partnerships, we look at fantastic partners like Healthcare Ready and the stakeholders that they work with, and the individuals who are logged on right now, who many of whom represent, let's say, skilled nursing facilities or licensed care homes, organizations, or facilities. And we see that more and more that you are involved in emergency management, not because you asked to be, right? Most of the people online today did not sign up to become emergency managers. They signed on to a career in healthcare. And yet, because of today's risk landscape, everybody has to wear an emergency manager hat. And so what does that mean? Well, when I look at Paradise, I can tell you what it was like to go up to a facility and go into that parking lot and see wheelchairs and walkers and canes strewn throughout the parking lot, some of which were turned on their sides, most of which had personal effects by them, wedding photos, jewelry, wallets. And it became very clear that what had happened was everybody evacuated the building. And care facilities are fantastic usually at a fire response, because that means we get everybody out of the building. But where there needs to be improvement is when you're not just dealing with getting somebody out of a building, but rather evacuating everybody out of the county, right, out of the city. At that point, you've got a very different issue. And in this case, they realize we've got a handful of accessible vehicles. We've got to drive, there was a couple hours each way, and just simply more bodies than they could take with all the equipment. And so the durable medical equipment in large part stayed. Much of the assistive technology stayed. And people were literally put into staff vehicles, and it became one of those situations of how many people can we fit in one car? And that's how they got people out. Amazingly, at that particular facility, everybody made it. Now they needed new equipment, but we can get equipment. That's something we can come by. The important thing, of course, is that they were alive. But looking at issues like quick evacuation, how many people that we serve are going to require accessible transportation, and how many accessible transportation resources do we have immediate access to? And there's going to be a delta there, right? There's going to be a gap. In order to fill that gap, we have to be creative and proactive in working with local and state emergency management, but also in working and collaborating with our sister facilities, setting up MOUs and MOAs that say not just on a bad day I can borrow your resources, but on a bad day, what surge capacity look like for where we take these individuals. Because, of course, for many licensed care facilities, you're not going to go to a shelter that's down the street. You're going to go to a like facility. So I think that perspective is where we need to do a little bit more right now. It's just recognizing that all of us are in this issue or this landscape. All of us have this challenge, this responsibility, but also all of us have an opportunity to do something innovative to save the lives of the people that we serve. So, thank you.
Great. Thank you so much, Vance. And that was, you teed me up very well here for some of the closing thoughts and ideas we had for the rest of the webinar. And one of them here, there's a slide here that with a common phrase in the field, all disasters are local. So that means that they're your traditional emergency responders, including those at Cal OES in your state, in your county, in your local emergency management office, but healthcare workers and healthcare providers are often on the front lines, and if not first responders, first receivers of those in need, and making sure that patients have continuous access to care. So you said it better than I could have, and you teed me up right for this slide, so I wanted to thank you for that. And just to underscore some of Vance and Dana's points, we know that kind of disaster preparedness is if not at the top of folks' minds, it's something they're thinking about. So here we have this is a statistic from a poll that Healthcare Ready that we do every year before hurricane season. And it's a national poll to get a sense of what Americans are thinking about in terms of natural disasters and other emergency events. And so we've seen that from our poll data this year, one of three individuals polled selected natural disasters their greatest disaster of concern, more than an environmental disaster, a disease outbreak, or others. So we know that folks are thinking about this, but then at the same time, not over half of those polled didn't have an emergency plan in place. And so we're excited to be on webinars like this and doing outreach like this to help give folks the tools they need to build an emergency plan, especially one that incorporates your health needs and your health and medical resources. So I'm going to skip ahead and just to dovetail on what Vance and Dana were saying earlier with some lessons learned from real-world events, including the California wildfires. And so there were just two programs specifically that I wanted to mention here, kind of two activities and that Healthcare Ready that I know we participated in, but ones that were messages that were amplified by partners and that we wanted to make sure those on the line today knew of. And so during the wildfires, one of the activities that Healthcare Ready participated in was pushing out information about emergency prescription refills. So oftentimes when there's a state of emergency declared at the state level, oftentimes there will be exemptions for early prescription refills. So if there's a state of emergency declared, as there was in California, patients were able to get an advance on their prescription medication up to 30 days without the prescriber's authorization. So one of the things that we were doing during the wildfires was trying to make sure that patients and patient groups knew about this, so that when there's a state of emergency, there are certain exemptions lifted that you can get the medicines you need, get some of the care that you need early on. Another piece I wanted to mention that hopefully folks on the line either heard about or will walk away from this webinar knowing more about is a prescription assistance program called EPAP. And EPAP is the Emergency Prescription Assistance Program, and it's a federal assistance program that allows patients that are uninsured to get up to a 30-day refill of their medications. And the idea behind EPAP is that it's more important for patients, even those uninsured, to have continuous access to their medicines during any kind of emergency. So this federal program, EPAP, is turned on for catastrophic events. So Healthcare Ready, along with our partners at Cal OES and California Department of Public Health, we're pushing out information about this. And we do this on social media, but also in our sit reps. And so these were just, again, two resources or two programs and activities that we wanted to make sure folks knew about. And again, these slides will be available after the webinar and have much more information in them than I'll cover on the webinar today, but you'll have this in your inboxes as well. And so at the last 10 minutes, I'll close with some resources for both patients and caregivers and make sure we leave enough time for questions. So I wanted to highlight again just a few resources that Healthcare Ready has, and those are some of our partners. So they're a little bit hard to see here, but they're on the right is an image of a card called the RX on the Run. This is a card that Healthcare Ready provides. It's on our website, and it's a wallet-sized card that has your prescription information on it, and as well as your provider information. And the idea is that RX on the Run will allow you to create a small, again, wallet-sized card with all of your prescription information, or that of your loved one or a family member that you can take with you when you're evacuating. So it's just an easy way to be able to carry the information that you need. We also have a number of tip sheets on our website, and these are tips for preparing for a natural disaster, as well as staying healthy during a national disaster, and then recovering from one as well. So there's kind of a series of 3 resources. And of course, I wanted to encourage folks always to follow your state and local officials on social media, as well as signing up for their email alerts as well if they have those. And the final resource I did want to call out was the California VOAD. And VOAD is an acronym for Voluntary Organizations Active in a Disaster. So this is just a quick screenshot of their website here, but VOADs are kind of the umbrella organization for nonprofits and others that are active in disasters. So there will be nonprofits that provide health and medical resources, but also transportation, food, any other kind of health and human services needs and social service needs are captured under this CalVOAD umbrella organization. And just with the last few minutes here, I wanted to touch on, some maybe more uncommon resources or resources that you may not think of, ones that are coming online. And so it's kind of, the text on this slide might be a little bit hard to read with I'm looking at it now with the white text, but over the last few years, we've seen that, as technology becomes more and more advanced, that there are additional resources coming online during disasters. One of them we often see provided through Uber and Lyft and other ride-sharing services. We've seen that they'll provide rides to shelters at no cost for patients. So they'll provide rides to shelters, but oftentimes rides to healthcare provider appointments during disasters as well. So it's something to follow, knock on wood, during the next wildfire or an earthquake, any other kind of event impacting healthcare and public health. We also see that telemedicine providers during declared emergencies will offer their resources at no cost to patients in the impact zone. So wanted to just kind of flag and get you thinking that there are resources outside of just state and local partners, but there's a lot of goodwill in the private sector and the nonprofit space for these resources. And we have a kind of an ugly looking slide here, but these are screenshots of some of the examples of these resources. So Uber and Lyft, like I said, will provide rides at no cost. Airbnb will open up their disaster program. Telemedicine providers will provide some resources at no cost. So these are the kinds of things that Healthcare Ready that we mention in our sit reps and push out on our website, but social media is great for finding this information as well. And so finally, again, as Dana and Vance are both saying, that the value of public-private partnerships and just kind of partnerships in general for disaster preparedness and response is invaluable, especially in the healthcare space where we know over 90% of it is owned by the private sector, but then it's public sector responders who are involved with the managing of a response. So these public-private partnerships, ones that Healthcare Ready helps promote, but ones that I know the CPAT is helping to promote as well. You see them all over, and they play a critical role in making sure that patients have the information that they need before, during, and after a disaster. And so just wanted to close with some of those thoughts on the value of public-private partnerships. And so with that, again, a few more closing thoughts that that we kind of hear commonly in the emergency management field. One of them is, don't just prepare for the last disaster. So while there will be lessons learned from those, each disaster is different and could provide different challenges. So try not to think about just the challenges you had last time. We also know that ancillary care, so not just hospitals, are important in making sure that patients have access to care during emergencies. So dialysis centers, community health centers, urgent care clinics, we know that all of these play an incredible role and are being accounted for in plans. And finally, we know that there are some still vulnerable populations that require more resources than others, and we know that there are some gaps in these resources for these populations. Like Vance said, we've come a long way, but there's still some gaps there that we're working to fill. So I know we have just about 5 minutes left, and I'm happy to open it for questions, and my contact information will be in these slides as well if you think of some questions later on.
Well, Sarah, Dana, Vance, this is Brandon. Thank you all so much for that really wonderful and important information. We do have a couple of questions I'd like to pose in our remaining minutes. One of the questions was, Sarah, one of your slides said that pharmacies would be available for people who need to charge devices, assuming that's ventilators, power chairs, things like that. Do you know if that's true for all pharmacies, or is it on a case-by-case basis?
Sure, excellent question. And I think it would be more of the latter, the case-by-case. So an example I can provide is that during Superstorm Sandy, we know that patients were looking for places to charge their cell phones And so we used the RX Open Map to find some of the larger pharmacies that were online and able to serve as a place for charging stations to be put in. So there are case-by-case basis. We don't want to say that every pharmacy is able to fill that need, but the RX Open Map can be a place to start to call pharmacies to at least learn what services they have.
Very good. And then another question is, can RX refills, RX assistant programs, do they include specialty medicines as well as prescription cocktails? Obviously those are a bit more challenging than common prescriptions.
Mm-hmm. No, another excellent question, and this is one where there are so many prescription assistance programs online that there may be some that are able to meet those needs. I know there's the Partnership for Prescription Assistance, which is now known as the Medication Assistance Program. This is a website I can send you, Brandon, to make sure it's included in the webinar, the summary slides. But there are prescription assistance programs that you're able to enter your information and it can match you to a program that you're eligible for depending on what your medication needs are, what your socioeconomic status is. So there are some matching programs that might be able to provide more information on that.
Perfect, and I'm guessing a pretty common sense question, but still always good to ask. Someone asked earlier on in the process that, technology permitting, still probably a good idea to contact a pharmacy to make sure it is open, even if it shows that it's open and available once the system gets activated.
Absolutely, and we do have that language on the RX Open website. We remind folks to call before you go. So the RX Open Map is a start, but the information is, the map is updated several times a day, but it's not, necessarily real-time information, so we always encourage folks to call.
A question that just came in, obviously in the last couple of years, telemedicine has been becoming more and more popular, especially people that have accessibility issues. Are there a list of telemedicine resources for people that might be dealing with some kind of emergency situation?
Yeah, excellent question. And so kind of the way that we've been tracking it has been almost on a case-by-case basis. So it depends on, the nature of an event. But Healthcare Ready, we track on social media if there are telemedicine resources that are being made, at no cost. I do know some of the larger names like Teladoc, MD Live. There are some bigger players in this space that are common to follow. I know many are developing partnerships with chain pharmacies, so Walgreens, CVS, and others. So I don't know if there's an exact list of major telemedicine providers, but there are some major players that, again, I can send them to you, Brandon, to include with the summary from this webinar that goes out.
That would be perfect. Seeing how it is just a minute or two before noon, I want to thank Sarah, Vance, and Dana for participating in this call. Normally at an in-person event, this is where I ask everyone to give you a round of applause, but seeing how they're all on mute, that's not possible. So please imagine that everyone is applauding you for giving your time and expertise to everyone for this really fantastic event. As we've been asked a couple of times on the chat session, yes, we will be sending out this PowerPoint to everyone, as well as some additional resources that all three speakers touched on to try and provide you some resources that you can share with your organizations and with your health contacts, because we want to make sure that Californians as a whole are prepared to handle all the types of disasters that our state faces on a yearly basis. As you can see on this slide, you are free to reach out to either myself, Brandon, at Sorrel, or my colleague up in Northern California, Kelly, with Perry Communications. Our two groups handle the California Partnership for Access to Treatment Network, and we're more than happy to connect you with some of these resources, and hopefully you'll want to participate in future CPAT in-person and webinar symposiums to learn more information about pressing healthcare issues facing California. I see that it's noon. I thank you all so much for participating and giving us some of your day. We look forward to emailing you soon with these resources, as well as a brief survey that I hope you'll participate and give us feedback, and enjoy the rest of your day. Thank you so much.